Hello, everyone, and welcome back to the podcast. So excited to be recording live here in Vive in Los Angeles. I'm so excited to be with the amazing Abhi Sindhwani. He is the Chief Growth Officer at Partic. Abhi, welcome.
Thank you, Saul. Glad to be here.
Yeah, it's so great to see you. It's been a while. I think we ran into each other at HFMA last.
We did.
And now we're making it happen here.
Yes, and I appreciate it.
Yeah, of course. Listen, for everybody that doesn't know you or the organization, let's start there. Help them understand more about you, your background, and also who Partic is.
Absolutely. So Abhi Sindhwani, Chief Growth Officer at Partic Health. I joined about 2 months ago, but I consulted with them previously. Healthcare, 20 years, health tech, quite a few startups. Haven't had a win yet, so we'll get there. I basically have been in the clinical workflow space for a while. And when we ran into each other, I was in the provider credentialing world. At Partic Health, though, the reason I joined them is it's personal. So about 3 years ago, my mom had a stroke. She lives with us in North Carolina. Her stroke happened with my siblings in Ohio.
Oh, okay.
To coordinate discharge, rehab, medical history, orders from Ohio to North Carolina were a nightmare. And I decided at that time that I need to work somewhere in healthcare that will actually try to solve this problem. So I came to Partic Health because at Partic Health, we're empowering care teams to refocus on the patient by providing seamless data via an intelligent platform. I can get into it what that really means, but that's what we're trying to do.
Well, I love it. So succinctly said. And I had the privilege of, seeing the panel that you were a part of yesterday. Talk to us about the panel, obviously, for the folks that couldn't be there and hear it. What was it about? Who was there? What did you guys talk about? Because I feel like the conversation that happened there really outlines the problem.
Yeah, that's very important. So the panel was supply and demand of data, right? And there were different aspects of it. Is supply the problem? Is demand the problem? Are both sides of the equation a problem? And on the panel, I had two people, one from Athena Health, Joe from Athena Health, Mike from Meditech, and Priyanka from HealthX. So it was a great panel where we talked about how siloed supply, no matter how much demand you generate, is still going to stifle what everybody needs. So what does that mean? Look, we have a problem in data interoperability. We all understand that. So if you shift the onus on the patient to say, only if patient had access, that we will be in better shape. Sure, yeah, we could. But unless you improve the supply and trust in data, how do you put the onus on the patient to navigate their care journey?
Right.
So that was sort of the panel makeup, and everybody had a take on it. And my take was, look, we need to contextualize the data that we give the patient. So think about this. We're at a healthcare conference. Yesterday, I asked how many people understand 270, 271. I said, what if in your medical chart it said your 271 has been approved? Does that make any sense to you? Right?
No.
Well, what if I said your medication has been approved?
That makes sense.
Right? Context matters. Context with trust, context that builds trust matters.
Yeah, no, that's really great. And so, data is the issue. Timeliness of that data is the issue. Talk to us about Partic and what you guys are specifically doing around that problem.
Yeah. So at the very outset and foundationally, what you need is a source of truth. What you need to be able to do is, if you look at my name, it's Abhishek Sindhwani. I go by Abhi Sindhwani. Now, over the last 10 years, I'm sure there's been many versions of that in many different EMRs at different physicians. There are many companies out there that will go get that data, but they don't check for demographics. They don't enrich the data. They don't validate the data. They just capture it and send it out to whoever wants to consume it. At Particle, we realized that, again, that's putting the onus, throwing stuff over the wall. That's putting the onus on the consumer. So instead, we do two things. We actually grab all the possible data, demographics, enrich it, make the call to the national HIEs, bring the entire breadth of that data, validate it, deduplicate it, clean it up, and then provide that with a high confidence to say, here, this is accurate. Because we have access to this stream of data, we can also tell you, alert you on when something happens with the patient. So, I'm from Ohio, live in North Carolina. If I were visiting Ohio and say I had a fall, went to urgent care, today my primary care physician does not know that I had an event.
Yeah.
What we are trying to do is ensure the entire healthcare ecosphere that surrounds me understands that I had an event and then act accordingly to take care of me.
Mm-hmm.
What a novel concept. Take care of your patient.
Yeah.
Focus back on the patient.
That's great. And it's about really visibility across the continuum of care, regardless of if you're within the network that your provider is, assigned to.
Yeah, let's talk about that a little, right?
Like your mom, right? Your mom example.
Yeah. My mom in Ohio versus North Carolina, different hospitals, different health systems. We had to coordinate care, printing charts, printing orders, bringing it back to North Carolina, giving to the health system, scanned it in, saved it. But it was not available as structured data. Mm-hmm. It was unstructured attachment that was added to her record in North Carolina. So I do hear that, look, Epic's huge. Now, what if Epic was the ecosystem? Great, makes sense. But even within Epic, different Epic instances are not connected. If Epic is the dominant player, then basically a monopoly. They can decide tomorrow they don't want to play nice with anybody else. We all get impacted as patients. Mm-hmm. It's not a story about an organization surviving and trying to do this, make data available for patients. But now it becomes a story of, do patients have right to their own data or not?
And the answer is they do.
Yes, they should. They should have access to their data. The data is part of HIPAA. P is for portability, right? The patient data should be portable with the patient. And we should all work on that. And I think it's a very novel thing that Particle is fighting against is information blocking. Let's all focus on the patient. Let's do the right thing for the patient. And let's make sure that patient has the data that's required at the right time, at the right channel, so they can get the right amount of care. They can live a healthy life.
Yeah, I love that, Abhi. And so, I want to cement this point to the right audience, right? So who are your customers? Who can benefit from the solutions that you offer?
Yeah, great question. So any organization that has a provider involved in the workflow. So it's a treatment use case. That means risk-bearing organizations, value-based care organizations, ACOs, payviders, payers themselves when they have care management nurses on staff who are actually working through your care routine or care plan. So all these organizations need to know what is happening with their population, member population or patient population. And generally they put them in two buckets: high intensity, high utilization, chronic care, young invincibles. Every now and then, right?
Yeah.
And we do that for them. We keep a closer eye on the top bucket of high intensity, high utilization, and lower cadence on the young invincibles. By doing that, we are also not wasting anybody's resources.
Right.
We use it in a manner where supply and demand connect. And ultimately, the patient feels like there is someone who will take care of them. And that person taking care of them, once they go through the longitudinal record, they have trust in the record to say, when I walk in, now I'm going to build trust with my patient to say, hey, Saul, I know what happened. Let me help you through the next steps. And that is so important in this ecosphere.
Totally. And especially when you talk about these more at-risk populations, where you have like an MSSP, for example, right?
Yep.
Like, you have stake in outcomes. You want to have savings. This becomes powerful.
Absolutely. This is proactively letting you know you've got somebody that you bear risk for is having an event. You can step in, take care of that journey for this patient, your member, and make it painless for them and better outcomes for you and them.
Totally.
And your customer, ultimately.
Yeah. No, this is fantastic. As you think about the solution that you're delivering, what's one thing that you feel people don't understand as well as they should today about how you guys do it?
That's a really good question. I use this analogy. We have prospects that come to us and they say, hey, we have a four-horse buggy. We need to add 10 more horses to be faster. We try to shift the paradigm, educate them. Hey, listen, that's great. We actually have an internal combustion engine and an automobile.
Yeah.
Yes, horses do transfer into this new mechanical thing. It is calculated in horsepowers, but it's not the same thing. So a paradigm shift from where they are to where we want to take them is the education piece. That takes time with us.
Yeah. So give me the equivalent of the horse buggy and the engine.
Of course. So horse buggy would be if you are a regional pair, you depend on your regional HIE or your state HIE.
Yeah.
You grab all the data. You think you've got everything covered, all your members covered. But when you raise your perspective a little higher and you look at your large groups, your large employers, who are maybe not constrained regionally,
Got it.
multi-region, even nationally, you're missing out on the patient movement and what's happening with that patient outside of your region. So would you not rather be connected nationally to solve that issue?
Got it.
And see the patient movement as it happens? Even if that population's smaller, two things happen. Hopefully, gives you the inspiration to expand your business outside of your region, because now you have the ease of this data flow. Secondly, the patients or the members that are outside of your region, now you're taking care of them as good as your regional population. Sort of the horse buggy to the internal combustion engine. The other is when we proactively alert that something took place with your patient or with your member, we quickly get classified into, I've got an ADT feed that does that. If for the audience, it's admission, discharge, transfer feed, right? That's great, but those feeds come from disparate sources. You're connecting to EMRs, you're connecting to brokers to get that data in. Well, we are going to the single source of truth into the 3 national HIEs. Not only are we pulling that data, we're enriching it, we're cleaning it up, we're structuring it so it's easier for you to intake and manage. So those are 2 big things. When you go from ADTs to our solution, which is holistic in nature, it's a very hard paradigm shift to go, well, I only know how to ask the questions on ADTs. How do I even evaluate you against that?
Understood. Got it. Got
Yeah.
it. Now I'm with you now, and
Yeah.
that makes a lot of sense. Yeah, you go from regional to multi-regional to national, then you go from ADT to something that is ADT aggregation, clean, enriched, and now you have something you can actually do it with. It's the engine.
Yes, and it's
the engine.
actionable, right?
And it's actionable. It's actionable. Got it. Makes so much sense, man. I love the idea of what you guys are doing. Any examples of it working today?
Yeah. We had an employee on site, and we had a couple customers come on our employee on site, dial in.
Yeah.
And one very interesting thing happened. We're talking to this person who's managing our data feeds and our alerting system. And when we asked her, why'd you pick Particle? What value are we delivering for you? Her answer, Saul, was what we strive for. She goes, we have tested your data again and again and again. And the way you provide the longitudinal patient record, it is so meaningful. Not only do you give us the actual record, we actually pop a discharge summary, AI discharge summary on top of it, which takes the most important things so you don't have to sift through 500 pages and puts it right on top for you to go through and know exactly what's happening. So their nurses, their providers use that discharge summary, read through the record before they walk in to talk to the patient. And the next line she said was powerful. She said, you empower us to build trust with our patient. And my nurses work at the top of their license when they do that. They feel satisfied in their jobs.
That's awesome. What a great example of leveraging technology, the many years of work that have gone on this, health information exchange infrastructure, like the opportunity to leverage the advanced AI tools that we have is literally now. It's at our fingertips.
Absolutely.
This is fantastic. And so as people think about, hey, can something like this fit within my organization? What message would you give them?
Yeah. Again, I think, I worked at Pairs for 10 years, right? So I try to put my pair hat on the other side of this, which is what are the things I'm looking for? Well, I'm looking for ease of integration, right? Low tech lift. I'm looking for reasonable pricing. I'm looking for, can I prove the ROI once I bring you in to my organization?
Yeah.
And are you going to be a good partner to me in the long run? If I look at those 5 things, I flip the script. And when I'm talking to my customers, I tell them, listen, none of these 5 things are going to stop us from getting the right solution in your hands. So I will do everything in my power to make sure it's a low-tech lift, easy integration. Pricing should not be an obstacle for us. We'll overcome it. We're customer-centric. I am always available. I will be partnering with you through every step. And last but not least, the journey doesn't stop here. We'll continue to solve these issues together, starting today, going into the future.
That's great, man. Really appreciate that perspective on that, Abhi. And so if people want to reach out and learn more about you and about Particle, what's the best place that they could do that, both for the company and for you?
Absolutely. So mine's very easy. It's Abhi, A-B-H-I, at particlehealth.com. Feel free to reach out to me. And if you like to learn more, it's particlehealth.com. Visit the website, learn about us, reach out to me or anybody on my team, and we'll be happy to get in touch with you.
That's great, man. I really appreciate you sharing the new way of doing the patient record. For everybody with us, just want to say thank you for tuning in to this interview with Abhi Sindhwani. He is the Chief Growth Officer at Particle. Check out the show notes for all the ways to get in touch with him and the team at Particle. And share this one with your friends. Share it with your colleagues, because the solutions that are at the tip of the spear come straight from here at Vive. Abhi's there to be able to help you with anything that you need. And thank you all for tuning in. Abhi, thanks for being with us.
Thank you, Saul.